Patients with eye disorders. We look at subjective for double vision, blurred or clouded vision, diabetic retinopathy or neural problem, decrease or absent vision, sensitivity to light, glare, the lens thickens and yellows with age, excessive light becomes an irritant. Objective assessment. Testing visual functions, examples like the Snellen E-chart, read newspaper print. Check the extraocular movements, look for nystagmus, eye deviation, tearing, discharge, clear or purulent, color of sclera, white, yellow, or pink, glasses, contact lenses, pupils, are they perla? Do the eyes crust, blinking, rubbing, edema of the eyelids, ptosis, squinting, or drooping of lid, symmetry, accommodation, peripheral vision. Need to look at and under eyelids and conjunctiva. Accommodation is the ability to look at and focus at a distance with the pupil. It's dilating. Then look at something close up and focusing with pupil. Constricting. Disorders of vision are frequently indicative of systemic disease. Disorders that affect the eye usually lead to impairment or loss of vision. Problems seen in the dark lens, opacity increases, would be like cataracts. Spots, floaters, halos around lights. Sudden means retinal detachment or glaucoma. Chronic occur normally in the elderly or in myopic patients. Routine and early examination of the eye can provide information regarding diseases and other body systems. Vision has recently been the focus of innovative and medical surgical treatment. Meiosis is pupillary constriction. Mydriasis is pupillary dilation. Normal findings, the external eye structures are symmetrical, lacrimal apparatus non-tender with clear drainage, conjunctiva clear, sclera white, and perla. Lens are clear, EOMs intact, disc margins sharp, retinal vessels without hemorrhage or spots, visual acuity 20/20 in both eyes, would deny diplopia. Age-related, we'd see decreased eye muscle tone, echotropium or dry eye, arcus senilis, corneal changes in color of sclera, and less ability to dilate pupil. More light needed for reading. Functional changes include lens with yellows. Accommodation is gradually lost. Near point of vision increases. Presbyopia. Far point decreases. Color perception decreases. Visual field testing looks for defects and their locations by having patients stare at a light while other lights are flashing in the periphery, also called a confrontation test. A slit lamp, which is a specialized magnifying microscope, is used to examine the structure of the eye, including the cornea, iris, vitreous, and retina. The slit lamp is used to examine, treat with the laser, and photograph the eye. Drooping of the eyelid is called ptosis. Ptosis may result from damage to the nerve that controls the muscle of the eyelid, problems with the muscle strength as in myasthenia gravis, or from swelling of the lid. Graves' disease is a common cause of hyperthyroidism and overproduction of thyroid hormone, which causes enlargement of the thyroid and other symptoms such as exophthalmos, heat intolerance, and anxiety. In the bottom picture, the normal thyroid size is in pink and an enlarged thyroid is in blue. Refraction is the ability of the eye to bend the light rays so that they fall on the retina. Your retina nervous sensory is the organ that receives the image or info in order to send it to the brain for translation. Myopia, nearsightedness. Eye is too long or there is excessive refractory power. Concave lens used to correct the refraction. Image is focused in front of the lens. Hyperopia, farsightedness. Eye is too short, or there is an inadequate refractory power, and biconvex lens is used to correct the refraction. Image is focused behind the retina. Presbyopia, loss of accommodation due to age, caused by changes in the lens, farsightedness, and normal part of aging, and starts around age 40. Astigmatism, blurred vision, either myopic or hyperopic, caused by irregularly curved cornea or lens. Aphakia, lens is absent due to congenital defect, trauma, or surgery, cataract extraction. Treating nearsightedness, the cornea is made flatter. Treating farsightedness, the cornea is made steeper. Treating astigmatism, the cornea is made more spherical. Assessing patients with eye and vision problems. Legal blindness is the ability to see at no more than 20 feet what normally should be seen at a distance of 200 feet. Legal blindness may also refer to severe restrictions in the peripheral field of vision with corrective lenses. Subjective decrease in loss of vision. These patients can feel frustration and anger. Objective. Visual field is less than 2200 in vision testing. Corrected vision is less than 2200 or is 2200 in better eye. Interventions. When speaking, be first to address the patient and not the family member. Establish eye contact with the patient. Describe the environment to help orient the patient. Use the clock method to describe objects for meals. Cataracts. The causes could be from head trauma, hereditary, congenital factors, exposure to radiation, diseases such as rubella, patient on long-term steroid use, patients with insulin-dependent diabetes may develop cataracts at a younger age than one who does not have diabetes. Also could be environmental, smoking, and UV light. It is slow, painless loss of vision. Photophobia is that they're unable to tolerate light due to glare. Diagnostic tests, ophthalmoscopic examination, slit lamp microscopic examination. Indications for surgery include interference with normal activities, obstructing view of the retina to diagnose other ocular disorders such as retinopathy and cataracts causing glaucoma. If lens implant is not done at this time, must have special glasses. Aphakic glasses are made or special contact lenses made. Pre-op meds, mydriatics produce pupil dilation. Cycloplegics produce pupil dilation. Valium is for anxiety. Care of the patient, tell them do not rub the eyes. Observe for increased intraocular pressure. Prevent infection. Prevent injury. Reduce lighting. Post-op care, antibiotic drop or ointment. Corticosteroid drops. Pain meds, antiemetics, positioning, and avoid Valsalva. Pathophysiology is the pressure within the eyeball is higher than normal. Increased ocular pressure leading to damage to the optic nerve could lead to blindness. Primary open-angle glaucoma occurs 90% of the time. Closed-angle or narrow-angle glaucoma about 10%. Abnormally high intraocular pressure. This is untreated glaucoma will lead to gradual vision loss and blindness. The risk factors, the most common cause of blindness in African Americans, increased age and family history, and diabetes. Primary open-angle glaucoma is a complex multifactorial disease in which there is a progressive damage to the optic nerve. Damage to the optic nerve causes a loss of nerve fiber tissue and leads to a progressive loss of peripheral visual field. It can be difficult to diagnose primary open-angle glaucoma due to the fact that there is not one single test, sign, or symptom that is a clear indicator that someone has glaucoma. Instead of a series of tests, follow-ups are necessary to establish a baseline health assessment as well as look for changes over time. Closed-angle glaucoma is relatively uncommon compared with typical open-angle form. In open-angle glaucoma, the entrance into the trabecular meshwork is unobstructed, though an abnormality deep within the meshwork leads to elevated intraocular pressure. In closed-angle glaucoma, the entrance to the trabecular meshwork becomes blocked by the iris, which assumes an abnormally forward position. Aqueous humor cannot gain access to the trabecular meshwork and drainage canals, causing the intraocular pressure to increase. In retinal detachment, the sensory layer of the retina pulls away from the pigmented layer, the choroid. The vitreous humor seeps behind the retina. The choroid layer nourishes the retina, and one or more breaks in the neural layer allowing vitreous humor to collect between the neural and pigment layers. The causes is recent or previous trauma, blunt or penetrating, aging process, diabetes, severe myopia, retinal degeneration, aphakia following cataract surgery. Subjective assessment, floating spots from blood or retina cells as a result of tears, recurrent flashes of light, current effect described as a shade pulled over part of the vision, and gradual painless loss of vision. Objective assessment, visual acuity assessment, retinal separation on ophthalmoscope exam or use of slit lamp microscopy. Interventions are cryosurgery or cryopexy. Freezing the probe causes retinal scarring. Photocoagulation, the laser beam through the pupil produces retinal burn and scarring. Scleral buckling, shortening of the sclera to force the choroid closer to the retina. Vitrectomy, surgical removal of the vitreous to relieve traction on the retina. Nursing management is bed rest. Opposite affected eye, maintain protective eye patch. Pain meds, tranquilizers to promote rest and reduce anxiety. Avoid coughing, straining, and bending over and dim the lights. Growth of new blood vessels or abnormal accumulation of waste material, the drusen, into the area of central retinal vision, the macula that blurs the central vision. Causes unknown. Most cases are age-related, and this cannot be prevented or cured. Subjective assessment. Central vision loss in one or both eyes. Patient complains of blurred vision, distortion of straight lines, dark spots or intermittent blurring or central vision that worsens over time. Decreased ability to distinguish colors. Vision with macular degeneration. The central field of vision is blurred or unclear. Treatments may include laser photocoagulation, only about 10% are successful, vitamins, minerals to slow visual loss, and steroid therapy. Nursing management, orient to room, always identify self when entering room, optical aids, telescopic lenses.